Hello, and thank you for joining me for the coronavirus information, coronavirus update. I just wanted to make a video about some of the recent news, of which there's been a lot, and it seems to go contrary to why most countries continue to be in lockdown. Why do we continue to be in lockdown? That's a very important question. Because in many ways the science seems to go against it. And let me just get into a few points before I get into the full analysis of this, because I just wanted to bring up some points about this, so about COVID-19 and why we continue to be in lockdown. There was a recent show by Tucker Carlson, and he did a brilliant and very on-point analysis of the current situation concerning some of the conflicts and the contradictions in the coronavirus hysteria. So I just wanted to bring some of them to the fore here. The computer models that we base the international lockdowns on, most notably at Imperial College and University of Washington, models were based on, they were incredibly wrong. They were incredibly off. They were saying like millions of people were going to die or hundreds of thousands of people were going to die from this virus, which did not occur. And that's why we went into the lockdowns in the first place. Okay. Those did not pan out. So why are we still in lockdown? It's a good question. Okay. Obviously we still have to keep people safe. That's understandable. We don't want the curve to spike back up. That's understandable. Okay, but if the models were incredibly wrong, and we continue to use models that are incredibly wrong, we're probably going to just continue to overreact. Okay. Also, there was a study in Germany, in Bonn, that most of the cases there they found were due to sustained contact, not passing contact with coronavirus infected people. Okay, so if that's the case, and it's really sustained and personal and long-term contact with people that is what is causing most of the infections, for people to be infected with the coronavirus, then there is really no reason to lock down the streets where there is just passing contact. Okay, so that's another funny thing, another important contradiction, or maybe an inaccuracy in the reporting. That we all need to stay at home, and we all need to wear masks when we're on the street when it's just passing casual contact. According to a study that was done in Bonn, Germany. Most of the cases there that they studied were due to sustained personal contact, long-term contact between people, usually in the same home, which seems to go against the official line that many governments are pushing and many media outlets are pushing. Okay. The other thing that I would like to bring up, in addition to that, is that governments around the world, and even the media itself, is guilty of pulling a bait and switch. If you hadn't noticed, in the past month. Originally, we were just supposed to flatten the curve, if you remember that. That was just to, so the cases were not rising, and the cases were not going up, increasing or spiking. Okay, but now it seems the ultimate goal is either to get a vaccine or to bring us to a situation where there's not a single coronavirus case on Earth. Okay, and I don't know how that's going to be possible. For any disease or any illness to reach a level where there are zero cases. We certainly haven't done that with AIDS, or there are some illnesses that are still out there that that haven't gone away completely. So that is an unreasonable thing. But if you notice, there's really been a bait and switch, where originally we were told, we just need to go into this lockdown. It's just temporary. We were told by the governments and the media that just to flatten the curve, just so the cases are not spiking, just so we know that they're either even or going down. But now they completely switched that argument, and now it's either need a vaccine or we need to make sure there's not a single case of coronavirus on Earth before we can all resume our lives again, or businesses can open again. People that are really, really suffering in this. Which is something we've never done before in certainly in recent history concerning a disease or virus or something, a major illness, is to just shut down everything. And especially when the numbers don't bear that out. And even Dr. Fauci himself in the New England Journal of Medicine stated before at the New England Journal of Medicine, which is quite a respected medical journal, that the coronavirus has a 0.1% death rate, okay, which is at or below the level of the common flu, okay. So just think about that and wrap your head around that. So we've locked down so many countries around the world. We've put people in incredible hardship, concerning their businesses and their careers, and why? Because according to the highest medical official who is running the coronavirus task force in the USA, that this virus has a 0.1% death rate. So wrap your head around that. Basically most of the world is shut down because of a virus that, according to one of the highest ranking medical official in Trump's coronavirus task force, has a 0.1% death rate, which is at or below the level of common flu, just to restate it again, to belabor the point a bit. All right, so again, from the bait and switch standpoint, we've gone back and forth, from flatten the curve to not a single case of coronavirus left on Earth, or we must find a vaccine, and vaccines can take a very long time to find. As if you watch any of the news shows, or if you watch any of the companies that are actually working on this, vaccines can take a year to 18 months, and by that time, everyone's either going to be out of business in your neighborhood, or people are going to start starving. So you have to balance this out a little bit. You have to balance this out and think about there's a chance you might get the coronavirus, and most of the people that do die from this illness, 99% in Italy and about 94% in many other parts of the world, had underlying conditions or comorbidities. So healthy people, with healthy immune systems generally do not die from the coronavirus. So, the world is under lockdown for a virus that essentially does not harm healthy people, So this is another problem with with everything that most of the governments around the world are pushing, and most of the media is pushing, that most healthy people, they even say this commonly on the news, either feel mild symptoms or no symptoms at all. They're asymptomatic. Okay, so how does that jibe with the fact that the entire most of the world needs to be shut down, other than Sweden, I guess, and a handful of other countries need to be shut down completely? It makes no sense. It seems like a complete overreaction, and it really is a complete overreaction. I mean, let's just call it what it is. And and you bring into the fact that the CDC, the Centers for Disease Control, have even openly stated just recently that sunlight kills the coronavirus. Sunlight. So you're preventing people from going out and spending time in the sunlight, where there's passing or casual contact between people, which at the University of Bonn or in Bonn, there's a scientist there that has shown that most of the cases have been contracted not from casual contact, but from sustained personal contact from people that are in close quarters for longer periods of time. So why are the streets shut down? It just doesn't make sense. People that are in passing contact, casual contact, have almost a very little chance of contracting this illness. And if they're healthy, if they have healthy immune systems, and they don't have underlying conditions like diabetes or lung conditions or or other debilitating illnesses, or pre-existing illnesses, comorbidities that compromise their immune system, there's almost no danger of them dying from this problem. You may get a little bit sick, you may feel that you have a flu, flu-like symptoms even, but the chances of you dying are about 0.1% or around there, give or take a margin of error. So, I mean, we've got almost the entire world locked down for something that, is about as dangerous as the common flu, I mean, does that really make any sense to anyone? Does it make any sense to you? I mean, think about this. Kind of, blot out all the media hype and just think about it for a second. Why is it, why are we shutting down the entire world? Why are we putting people in such hardship and under such difficulty and strain, and locking people up in their homes where and they don't have jobs or whatever, or they're just they're getting cabin fever or going crazy, or both, because of a virus that really is not that much much more dangerous than a common flu, and unless of course you're someone who has a compromised immune system or a pre-existing illness which would make you more susceptible to this. Okay, and those people certainly should be protected or isolated or quarantined or whatever, those people. But the rest of the world needs to go on with their lives. That's my view, needs to go on with their lives. All right, so it needs to get out of house arrest because, think of the psychological impact, just the psychological impact of this, and, there's people out of work, they don't have any income coming in, or maybe they have a little bit of income coming in from the government, or wherever, but they don't really have a future. And then over something that really, as long as they're a healthy individual without those pre-existing problems that would compromise them, then they're probably going to be fine, And we really need to build up herd immunity, which means, at least for the healthy people that are not, susceptible, highly susceptible to this illness, to dying from this illness, we need to let the virus, work its way through the population so that we can develop an immunity to it. We don't know how long that immunity will last, how long those antibodies will last, will prevent you from getting in the future, or how long it will prevent you from getting in the future. But, you need to find those things out, and you don't find those things out by locking people away. You really don't. I'm sorry, that is not how it works. And anyway, so let's go on with that, and then I also wanted to talk about Sweden, which I guess recently has had a little bit of a rise in cases, but it hasn't really been out of control concerning that. So, I mean, they didn't lock things down. They did, I guess a lighter version of the lockdown. 50 companies that have 50 employees or over, have to remain closed, but if they don't, then they can stay open. And they didn't spike for a while. They may be having some problems now, but it certainly did not get out of control right away. So we'll have to see how that develops. And anyway, so the pandemic, there were very few COVID-19 cases initially in Sweden. But you have to ask yourself you really have to wonder about the authoritarian overreach going on here. I mean, you really have to question that, okay? Is it really about keeping people safe? Because, and sticking strictly to the science, with so many governments and so many, technocratic individuals, bureaucratic, technocratic individuals really going overboard, okay, to use computer models to, first of all, overstate the danger of this illness, and now that we're a little bit wiser, we know a little bit more about it, that it's not exactly it is highly contagious. I guess that's pretty well established, but it's not as deadly as people imagined. So these authoritarian, measures that many countries around the world are engaged in now, are they really necessary in light of what we know now, and in light of as the science as it's developing, and even with the CDC coming out and stating that sunlight kills the virus, or at least it's very effective at killing viruses of this kind. So in light of that, shouldn't people be outdoors? Maybe still keeping social distancing to 1 meter or above, or what have you. But there's no reason to keep people inside and close all the shops, as long as people are a little bit conscious of what they need to do to avoid this illness and avoid getting sick. Okay, and especially people that are in the high risk category, and it's it's certainly something that they need to do. But I mean, it's time for everyone. I think, in my opinion, it's time for everyone in every country to start asking questions about, in light of what we know now, in light of the fact that we know that perhaps most countries the cases are going down. We know that what more or less who is in a high risk category for having serious problems, serious complications from this illness, people with underlying conditions or comorbidities. It was about 99% of the people in Italy that died did have those conditions, and Italy has a very old population, generally speaking. And in other places, it was about 94%. So we do have to ask ourselves, I mean, is it really necessary to continue with this, with these lockdowns and this overreach, in light of what we know now, or is it just like, or is it just like some people, whether they're Bill Gates or whether they're, government officials or whether they're bureaucrats or technocrats, are getting a little too fond of this power. I mean, I think this is something that people really need to start asking themselves and really need to start pushing back on, especially people who don't have jobs now and or who run businesses that are shut down because of this. You really need to start asking these questions and need to start pushing back on this before it's too late, because power is one thing that is very dangerous, and it can be more. I forget who said it, but he said power is the great aphrodisiac. You have to remember that these rights that we have, these civil rights that we have as people, free speech, free movement, free association, free assembly, freedom of the press, you do not realize, especially, many people in the younger generation, not that I want to single you out, but you do not realize how much blood, sweat, and tears have gone in for thousands of years to get these rights for people, and they can go away in a heartbeat. Or in the case of a virus, these rights that people have fought hundreds and thousands of years to get, the right to free speech, the right to free association, the right to free movement, the right to, you do not realize how much blood, sweat, and tears have gone into securing these rights for ordinary people, for ordinary citizens, and they can go away in a flash, and they will go away in a flash if you let them, okay? And it doesn't matter what excuse is used to trample on your rights or your civil rights. It doesn't matter what it is. It will always use fear to get you to give up these rights. Whether it's an enemy outside, or it's an enemy inside, or it's it's a virus or something else. You really have to stop and say enough is enough. Okay, when it doesn't follow the science, when the ducks are not in a row, and when things are not adding up, and people are still, grabbing power, or extending their power, you really have to stop and ask yourself. I mean, these are sacred, and once they go away, they're gone forever. Your civil rights, your rights to free speech, your rights to free movement, free association, privacy, things like that. I mean, especially the post 9/11 generation, you do not realize how fragile these rights are, and what a nightmare the world becomes when these rights go away, and it will become a nightmare. Just look at the history of the Soviet Union, or even China under Mao, or in many other examples throughout history. They don't even have to be right or left, authoritarian systems. There are many monarchies that were exactly the same way. And I'm telling you, once they go away, it's going to be another hundreds or thousands of years until they come back, and it's going to be a lot of blood, sweat, and tears again to get through it, to get these rights back, if at all. Okay, so you just have to. So we have to look at this in perspective. Okay, when the science is not adding up, in light of what we know now, and in light of the fact that perhaps flattening the curve is enough, and life is full of danger. Life is full of danger. You could walk out on the street and die from something. But if people have no money, if people have no business, if people have no jobs, they certainly will die. or they will go down, or in one way or another, and that is certain death. So anyway, so there's just some things to think about. I certainly don't want to depress anyone further in these most difficult times. There was another thing that I wanted to mention too. There was also an article or a show, the Ingram Angle, which I do watch sometimes. I think she's a smart lady. And there was a doctor on there, Dr. Scott Jensen was his name. And he did state that a lot of the COVID-19 cases, so-called COVID-19 cases, the World Health Organization is incentivizing hospitals and doctors to classify non-COVID-19 deaths as COVID-19 deaths. So they're boosting the numbers to make them look like there are a lot more COVID-19 deaths than there really are. I mean, I couldn't believe it myself, but it was on TV, and I mean, I can believe it. I mean, I don't think human beings are necessarily all holy and good. I've come to that conclusion, so nothing really surprises me anymore. But there was Dr. Scott Jensen is his name, and he did mention that many of the COVID-19 cases, they are goosing the numbers quite a bit to scare people. And also to, again, power is the great aphrodisiac, I mean, you have some mediocre politician or bureaucrat, no matter what country it is. I'm not singling out any countries. It's pretty much the same in all countries. You have mediocre politicians, you have mediocre bureaucrats, technocrats like Bill Gates or whoever, Not that he's mediocre. I'm certainly he's quite smart. But that just because someone's smart doesn't mean they're moral. You know what I mean? Intelligence and morality are not the same. I think people tend to equate them. But anyway, getting back to the point, Dr. Scott Jensen, he did point out that the World Health Organization is incentivizing hospitals and doctors to list COVID-19, non-COVID-19 deaths as COVID-19 deaths. Okay, so that's something to think about. Why are they doing that? Why are they trying to scare the public? Why are they goosing the numbers? Use your own imagination. Power is the great aphrodisiac. Anytime you can have politicians, bureaucrats, or technocrats, boost their power, or they can get in front of the camera, in the news, and make a big splash with some wagging their finger in the air and oh, this is terrible, and I know what to do, and I'm give me power, give me authority, I mean it's a chance for people to play God. Let's be honest, I mean we're not children here, it's a chance for mediocre personalities to play God, and to be the great figure of history. Maybe they imagine themselves to be the great politician, the great statesman, to be Cicero or whoever, or Pompey or something, or whoever, Caesar. It's their chance to be the great politician of history or the great man of history or whatever. By just milking these, milking the power and giving themselves, authority and power over people. Power is the great aphrodisiac, man. I mean, nobody is immune, or at least most people are not immune. And there was another great video put out by Dr. Shiva Ayudurai at MIT, where he taught. You'd have to see the video, but he does talk about the serious problems with with the assumptions about vaccines. One thing. And that vaccines are a cure-all. You have to remember that vaccines are based on the theory that you can inject somebody with a benign form of a virus or bacterium or something, and it's not going to harm you. So it is kind of a one-size-fits-all for the human body, for the human biology, which if you've ever studied biology is not true. There is no one-size-fits-all. Everyone reacts differently. Every body reacts differently, even to drugs and alcohol. That's why if you take a drug, if you go to the doctor and take a drug, often, especially if you're in the hospital, they have to observe what effect it has on you, because everyone's biology is different. So if you think that a vaccine has the same ingredients, is going to affect everyone exactly the same way, it's simply not true, you know. Dr. Shiva Ayudurai, MIT PhD, just, you know, basically just went off on Dr. Fauci, called him a product of the pharmaceutical companies, and a product of the, diagnose and prescribe model, the Rockefeller Foundation model for medicine. Which in many, what he points out is in many cases, many dangerous infections can be cured with vitamins. Many of the horrible illnesses in the past were actually cured by vitamins, not by vaccines. And vaccines are a product of the pharmaceutical industry, and they make a lot of money from them. That's one other thing he pointed out. So again, if you, please watch the video. He's absolutely brilliant. His name is Dr. Shiva Ayudurai, and I'll spell his name. His first name is Shiva, Shiva, and his last name is Ayyadurai. MIT professor, PhD, speaks all over the world. Very well-spoken man. Not an ivory tower individual. Speaks very plainly, very smart, very straightforward, and a very intelligent man. You know, very comprehensive. He has a good comprehension of the topics. He understands that a lot of doctors they really get taken into the diagnose and prescribe model, which makes a lot of money for the pharmaceutical companies. And Fauci certainly is a product of the pharmaceutical company. And he also points out that that vaccines, the reason that they're always pushing vaccines for every virus and illness is one of his main points, is because they make a lot of money for the pharmacy. They make billions and billions, hundreds of billions for the pharmaceutical companies. And many vaccines actually do more harm than good. I mean, that's the honest truth. You can look it up yourself. Anyway, so I should probably end this now. If you have, please feel free to comment on this. I brought up a lot of points here, and hopefully, if you have anything to add to that. I just wanted to give sort of a machine gun approach to some of the just a smattering of the latest information on the coronavirus. So hopefully you enjoyed this video, and please feel free to like and comment about this. And thank you very much for joining me. And be safe out there, everybody, and take care of yourself and take care of others. Bye-bye. See you next time.